Chris Weidman recently shared some updates following his leg fracture at UFC 261, sharing these X-ray images on his social media account. Welcome back, everybody. I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. In this video, I'm going to teach you some things about these X-rays and combine it with what happened in the fight to do a little bit of an update and expand on some teaching from Chris Weidman's leg injury. As always, if you enjoy learning about this unique side of sports, please consider subscribing to the channel. Hit that thumbs up button if you learned something here, and let's get started. The full extent of the injury was an open fracture of Weidman's tibia and fibula that we can see here on the X-rays that were done before his surgery. The R just stands for the right leg, and here we can see his tibia on kind of the left side of this X-ray picture, and then the fibula here on the right side. Since we're looking at the right leg, the fibula of course sits on the outside of the leg, and so this is going to be sort of the medial or inner, maybe a little bit of the front part of the shin, and this area, as we'll see in a little bit here, was kind of right where the skin broke, which made this an open fracture. Now, of course, Weidman stepping on his foot after he broke it certainly didn't make things any better, but if we look at the replay, you can actually see that the skin was broken, making this an open fracture before he even planted. This is after he's delivered that kick, and you can see this kind of cut going right across the front of his shin, which if we look back at those X-rays corresponds to the level of that tibia fracture. So this was an open fracture before he stepped on it. As his leg kind of releases from the kick here, we can even see where that skin was open, and so I don't even necessarily know if it was the bone that kind of tore through the skin as much as it could have just been the sheer kind of contact on Uriah Hall's leg, but either way, this was considered an open fracture before he stepped on it. And one of the main things we can learn from X-rays is the exact type of fracture and then the mechanism of how the fracture occurred. In the pre-surgical X-ray, it's tough because things are displaced. We only have one view, but in general, it looks like the fracture line of the tibia is maybe a little bit at an angle. Certainly here at the fibula, we can see that it's at an angle. But then if we look at the post-operative X-rays, we can get a better sense of the fracture pattern. Now that I'm zoomed into the tibia, you can see this little bone fragment that's off to the side, but then you can also see this horizontal fracture line coming through that kind of outer portion of the tibial shaft. That fracture line starts what we call transverse, meaning horizontal, but then when we get down to that little fragment, it goes a little bit more oblique, meaning it's down at an angle. This little bone chip is going to be a comminuted piece of bone, meaning that the bone fractured and broke into more than just two pieces, but we also can sometimes call this a butterfly fragment based on the fracture mechanism. Similar with what we're seeing down here at the fibula. We've got this kind of oblique fracture line, and then we've got this fragment that's kind of off to the side. If we look at our biodigital anatomy tool here, the first thing I want to point out is the general shape of the cross-section of the tibia. It's basically a triangle. The tip of the triangle is here in the front, and then on the sides, on the outside and inside, is kind of flatter surfaces. And then on the back side of the tibia is that third flat surface. So in cross-section, our tibia is shaped like a triangle. So the fracture line for Weidman basically looks something like this, where there was a little transverse part, and then we saw this oblique part coming down. We also saw this little kind of chip of bone that was coming off right here, and it's tough to see, but there's probably another oblique pattern that came up this way, because that's what will produce this little what we call butterfly fragment. So when Weidman's tibia made contact with Uriah Hall's leg, it was about at this area. So we had the initial trauma of that load coming in directly onto the inside portion of the tibia, but then as his leg continued to swing around, we introduced a bending moment, meaning the top and the bottom of the tibia sort of swung in this way as the leg kind of continued to bend around Uriah Hall's leg. A bending fracture moment like this causes this initially transverse, but then oblique angle of a fracture line. Then when you apply an axial force, meaning the bone goes into compression from the two ends, that's when you introduce this other oblique line where this butterfly fragment kind of chips off. So if we correlate that to what happened with Weidman, of course, we have that first initial contact right at that site where the fracture started, but then as his leg wants to continue to swing around, what we get is we get tension kind of on this back portion of the bone as it's bending away, and then we get compression on this front part of the bone that's getting closer together. And then as Weidman goes to step down, he's going to introduce some of that axial load into the fracture, compressing the two ends together, and I suspect that's what gave us this final fracture pattern. Now, just some other common fracture patterns to think of. Whenever we see a pure transverse line, that's usually in tension with the bone being pulled apart. If we see pure oblique line, that's usually compression when the bone is just squeezed together and the ends kind of slide past one another. And then one we commonly see is a spiral fracture, where it basically spirals up the shaft because of a torsional or a twisting moment that's produced within the bone. And usually in these high energy types of injuries, their patterns overlap. There can be kind of more than one fracture pattern, but there's usually one that sort of dominates the picture as the primary mechanism. Now you might be wondering why they didn't do anything with like a plate or a rod on the fibula, and that's primarily because once the tibia was stabilized, the fibula fragments were in pretty good alignment, and the fibula is considered a non-weight-bearing bone. It will bear maybe 10 to 20% of the body weight, but it's not enough to where you have to worry about the ends of them becoming kind of unstable and increasing in distance from one another, as long as you've got the tibia nice and stabilized. As we've seen, to treat this fracture, surgeons often use this intramedullary rod or metal nail that they put down from kind of the top up by the knee in through that inner canal of the tibia. This is a cross-section of a femur, so different bone, but it gives the same kind of sense here. This inner space of the bone where the bone marrow lives is called the intramedullary canal. So what the surgeons do is they put the rod down inside this canal to bring those two fractured ends of the bone together. That bone marrow is of course producing blood cells for our body, but we have tons of bone marrow elsewhere in the body, and so having that rod in just one tibia doesn't have any implications on the rest of your body's physiology. So now that we know that it was in fact an open fracture, we have to worry about infection risks here in the short-term period, but then everything else long-term is more about the other soft tissues, not necessarily the bone. The x-rays don't show us the muscles or the ligaments or the tendons, it only shows us the bone. And it's fairly common to have other associated soft tissue injuries with the ligaments or other tissues whenever we see an injury like this. So as Weidman goes through his rehab, those are going to be the bigger things to kind of keep an eye on here as he gets out of this initial post-op period, and we don't have to worry about things like infections, compartment syndrome, and more acute surgical complications. So that's it for the video, everybody. I hope this update was educational and interesting for you all to learn about some x-rays and how we describe different fracture patterns. Let me know as always any questions or comments down below, and until next time, we'll see you later.